This is the Bartholomew Town Podcast.
Hi, everyone. Welcome into Bartholomew Town's continuing coverage of the impact of COVID-19 here in Rhode Island. I'm Bill Bartholomew. On this episode, a conversation with Rhode Island-based nurse and state senatorial candidate Lenny Cioe. Well, good morning.
Good morning, Bill. How are you?
Great, Lenny. How you doing?
Excellent. Before we get started, I'm going to ask you a few questions.
Yep.
Have you been washing your hands?
Oh, my hands, you don't even want to see the amount of lather and corruption to my skin is
all right. And you've been wiping down surfaces after you're done.
We got right here, we got hand sanitizer.
All right.
We've got Lysol wipes. I've got Lysol bleach spray, Lysol regular spray, paper towels, rubber gloves.
And you've been staying 6 feet apart?
I've been in quarantine now since for 15 days. I have not, other than my wife and 2 roommates, I haven't seen anybody. So
okay. All right.
Been, and as far as in general, I've gone out for a few walks. Yesterday was the first time that somebody had a pit bull off leash when I was in a park, and the pit bull ran up to me. And that was the first time I got close to somebody. I gave this guy as much of a death stare as I'm capable of. You know what I mean?
All right.
People are, I was really discouraged, particularly the Newport St. Patrick's Day parade a few weeks back, where the city leadership didn't step in and cancel that parade in time. They had to wait for the governor to kind of intervene. And as a result, tons of people came anyway, even though the parade was canceled. People came to Newport. And that kind of broke my spirit. I couldn't believe that people, by and large, weren't willing to collaborate and cooperate on this. Just as a human project. So
there's a false narrative that was being spread.
Yeah.
Up to this point, and because of that false narrative, it gave people a sense of that this isn't serious. And that they need to. I'm sorry. I think we're going to pay a price for that. I really do.
Well, you would know. You're right there on the ground. And first of all, I appreciate your service. I think that's the most appropriate thing to say to healthcare workers. Now, I know you're in the business. You're doing it no matter what in your heart, but it should be noted that you're on the front lines, and it's something that I appreciate, and I think most people do as well.
All right. Thank you, Bill. Thank you.
So let's talk about, first of all, welcome back to the show. You were on like a couple of weeks ago, and in a different capacity, kind of. We're more talking about the origins of your campaign. You're challenging Senate President Dominic Ruggiero in a Democratic primary coming up. I think we're going to have that in September. I feel pretty good about that, no matter what. Today, I'm focusing on that, but also your perspective as a nurse here in Rhode Island and what you can report to all of us from the practical day-to-day work side of it, and then also from the gaps in policy that have led to some of the problem situations that we're experiencing.
Well, I'd like to introduce myself first. I'm Lenny Cioe. I'm a registered nurse, and I am running against Dominic Ruggiero, District 4, Providence and North Providence. The hospitals have canceled a lot of the elective surgeries, which frees up a lot of supplies. And now I work in the OR. Now only emergent and urgent cases are going to be done as far as Fatima. And I believe Rhode Island is heading in that direction. And that is going to free up a lot of supplies and nurses. What's happening at Fatima, and I believe at Rhode Island, they're taking those nurses and they're putting them in other areas as needed. I'm getting retrained to go back into the ICU or back into the floors, so that way they can use us and put us throughout the whole hospital as needed. So a lot of nurses are stepping up, and I am very proud of what the nurses are doing. It's only a nurse would understand this, or even as far as respiratory therapist, or it's very specialized. You have ICU nurses, you have med surg nurses, you have telemetry, you have cardiac nurses. And because of that specialization, you kind of get into a zone where that's your safety zone, and that's where you work in. So now the nurses are stepping up to go outside of that zone, and they're going and they're retraining themselves. They're getting prepared, and it really makes me feel good that the nurses are stepping up like that.
That's amazing to think about. Retraining in any capacity is not an easy thing to do, especially when you're dealing with a human life. You have your systems, you have your comfort zone, your tools, your personnel that you're working with in different capacities. So to mix that up in the middle of a crisis does require a certain amount of focus and dedication, no question about it.
Well, I grew into this profession. I started off as a respiratory therapist. Rhode Island Hospital had a really great education program at the time, and then I grew from a respiratory therapist into a nurse. And you're going to realize that healthcare professionals never went into this profession to be rich or for any other reason than compassion. Mm-hmm. And now that they're needed, they're there. And they want to be there.
Yeah, that's critical to understand that, it is a choice, it's and that inspires probably a better result as well when you're in there.
Well, a better result is from what the Rhode Islanders are doing outside of the hospital. Social distancing, staying in place, children at home. That is going to make a huge impact on what we have to do on the inside. And as I feel like a lot of nurses want to say thank you to the public for following Dr. Nicole Alexander's Scott's recommendations. I really believe that Gina Raimondo and her are doing a great job. A great job. She shut us down early, which is going to make a big impact. I know it's creating a lot of hardship, and I feel for that. But the impact in the long run is going to be a better outcome for all of us.
What are you experiencing at work right now? We're obviously not at the point where there's the quote unquote surge here in Rhode Island, but we are seeing an uptick of patients that are either hospitalized, intubated, whatever it may be. Are you experiencing people turning up with mild symptoms that are seeking some kind of treatment, or right now is hospitalization mostly focused on severe cases?
Hospitalizations is mostly focused on severe cases. They are admitting people that are symptomatic, but they have to be at the high end of symptomatic. That's the best they can do right now. We had limited testing up till this point. Now that we have drive-through testing, we'll have a better handle on how many people are actually sick. It'll give us a greater focus on where to put our energies and what we are going to need.
That's something that is constantly assessed in all of this. Obviously, the number of cases that are reported are confirmed cases or confirmed non-cases. There's, I think it's safe to say there's plenty more cases that are not being tested, or people who have not been tested that probably are carriers, and so on and so forth. So at this stage in the game, how far away are we from being able to pinpoint clusters, major areas that would, I guess, allow for quote unquote the economy to open up? Or are we nowhere near even thinking about that?
Bill, I couldn't give you an honest answer about that. And I don't want to speculate at all. All I do is take my orders from our Department of Health and my supervisors. To speculate where we are on that, I would talk to Dr. Scott. I mean, she would give you a better answer on that. I just know that what we did from the very beginning, it made a huge impact. Mm-hmm. I know it created a lot of anxiety. People got scared, but in the long run, I think we're going to come out of this sooner. I can't give you a date, but I think because of what we did in the very beginning, we're going to come out of it sooner than expected. My biggest fear right now is that the hospitals are under a financial pressure, huge financial pressure. Mm-hmm. And we have a General Assembly that's not meeting.
Right.
And we're going to pay a price for that. And because they're not meeting and they're not even trying to get together through internet or Zoom like we are doing right now, that's what's really frightening me. I mean, Raimondo only has so much that she can do as far as, she's done as much as she can, but the General Assembly has the power of the purse.
Right. Yeah, I think that's and something that Senator Sam Bell was on here yesterday. We were discussing that. That's the key issue surrounding the concern for the General Assembly not being open is frankly the purse strings, the mechanisms, the mechanics to do the things that are being proposed. Obviously, the governor can intervene with executive orders, and you can also do things that are, I don't want to say dubious, but, potentially going to not work out in the long term or hold up to legal scrutiny. But if you want to create a long-term strategy and fund it properly, it does require the General Assembly to be in session. I mean, what is going on there? What is there? What can possibly be the reason?
I'm going to be very honest with you. I got very upset. I have a lot of healthcare professionals, first responders, EMT. I can go on and on with the list of people that are putting their life on the line. We get sick from this, and we can die. I still read the Providence Journal. I still like newspapers.
Sure.
But because you find out interesting facts. But March 30th, on Monday, they had lawmakers help constituents from home. I'm going to tell you what Mattiello and Dominic Ruggiero were doing, and I'm going to read it right from the paper. House Speaker Nicholas Mattiello and Senator President Dominic Ruggiero are keeping close contact with each other and the governor and the treasurer about state cash. All right, so they're just speaking to each other. Mattiello is also social distancing on his Harley, catching up on his law practice, and spending time with his family, while Ruggiero has been dog sitting for his daughter, who is a pharmacist. So we're facing a healthcare crisis, all right? We're facing financial crisis. We're facing a complete collapse of the restaurant industry, and Mattiello's riding around on his Harley and Ruggiero's dog sitting. You're telling me they don't have the time to set up an internet where they can all meet and talk and get things going? With this financial crisis coming to hospitals, they need to be raising the Medicare premiums, Medicaid premiums up to help hospitals out of this financial crisis. They need to be meeting about housing. They need to be meeting about the restaurant industry. We're going to lose our economy. This state's going to be pushed into a recession because of their inactivity. I mean, they called the political cooperative a paper tiger, but at least they came out with a plan. At least they offered a recovery plan for healthcare, for housing. And they're he's riding around on his Harley in this. They should be ashamed.
Yeah.
Out of all the egregious things that Ruggiero has done, not voted for gay marriage, only raising the minimum wage to $1, this behavior right now is hurting the whole state. The whole state. He's the Senate president. He should be up there getting things ready, getting that internet moving. I'm sorry if I'm getting a little passionate and heated, but
I'm glad
People's lives are at risk because their health care is at risk. People's lives are at risk because their housing is at risk. And you're at home dog sitting for your daughter.
I can't wrap my head around. We started this conversation with service, where it's partially our conditioning, correctly so for the most part, sometimes a little bit wacky, but as Americans to just step up. But then as human beings to step up and serve in your role. You mentioned that in the healthcare world. I'm seeing colleagues of mine who are journalists well over the age of 60 who are out in the field presenting this information to the public. I just can't understand, if you have an opportunity to serve and you're an elected leader, why you wouldn't do everything in your power to make that happen. It seems that, I just don't frankly understand what could possibly be going on.
All right. When you take that vow of office, that is a vow in front of God, whether you believe it or not. And how they can face themselves and put that in the paper is beyond me. Beyond me. I mean, if this doesn't speak out to why we need to change what's in the state legislature and the General Assembly, nothing will. Nothing will. This is egregious. This is egregious. I mean, your state's facing one of the biggest crises in its history, and you're home dog sitting instead of getting the General Assembly around. I don't even know where to go with that.
Yeah, that's it. There's really nowhere else, because the only thing you can do is just you wonder if within the silo, and I've seen different sectors. Obviously, you're here now with this perspective. Senator Sam Bell was on here. I've seen House Minority Leader Republican Blake Filippi screaming about this online. And what I just don't understand is we see this situation play out in normal times, quote unquote, here in Rhode Island politics, where the lines of division, yes, there's left, right, and there are conservative and liberal positions, but as a lot of times it's institution versus non-institution.
This isn't about Republican or Democrat. This is about all of us. This is about the state of Rhode Island. This is about the people of Rhode Island. This is about their lives. This is about their housing. This is about their health care. Our state is going to be crushed by this because of their inactivity. And again, how can you look at yourself in the mirror riding around on a Harley? I mean, to put that in the paper, don't you think that's a slap in the face to every single citizen of Rhode Island?
Oh, I know it is.
Dog sitting is a slap in the face to every single citizen in Rhode Island. I mean, at the very least, get a public policy on healthcare up there from the state. Raise the Medicaid payments up to help the hospitals out. Yep. Healthcare workers all first-line responders were at epidemic proportions of burnout before this. After this, they're going to need a lot of help. Right. They're going to need a lot of help. The anxiety alone from this is going to create medical errors and medical mistakes. And it's not their fault. They're being stressed by the anticipation alone of what's coming at them.
Right. Wow. That's heavy. There's no other way to put it. I mean, what can we do? I mean, at this point in time, you're there on the ground. So even just going back to a professional context and less of a political one right now, what can Rhode Islanders by and large do right now other than call their particular representative or senator, call the House or Senate leadership and try to encourage the legislative body writ large rather, to get into some kind of virtual session to make the finances of the hospital.
Stop raising your voices. Stop letting your voices be heard. They took an oath. They took an oath. All right. I mean, I don't politically agree with Filippi. I'm going to say his name wrong. I'm sorry.
You actually had it, Filippi.
Yeah. I don't politically agree with him, but on this issue, yes. What's going to happen when the stimulus package comes in? Just the governor and Ruggiero and Mattiello are going to meet.
Right.
Where's the oversight?
Right. Oversight. That's the thing that is so critical now. Look, we keep getting into this. Look, people call me a loon because I'm suggesting that, again, when we talk about rent suspensions, mortgage suspensions, I'm not out there suggesting, well, everyone's off the hook. It's just about creating mechanics to make it so we have a reasonable system until the supply side of the economy is rejuvenated.
Yes.
And there's no
why is protecting people considered ludicrous?
Right.
Why is protecting their health care and making sure that they get health care ludicrous? Why is protecting their housing and their homes and their jobs ludicrous? It's not. It's about protecting the people of Rhode Island. Their inactivity is going to crush this state. It's going to crush the people in this state. It's going to create a housing crisis like we've never seen. It's going to create a homeless situation like we've never seen because of their inability to get off their Harley and stop dog sitting and get together and stop creating virtual sessions. That way we can get stuff done.
Yeah. I
would never, ever leave my patient. I don't care if I work 24 hours straight without somebody coming to relieve me. I would be there. They have the same obligation to the people of Rhode Island. We are in a crisis, and they're leaving the people of Rhode Island stranded with their inability to get together.
It's crazy. It's like bizarro times here on so many levels, and I haven't heard an explanation from anyone. In fact, I'm going to reach out to both Mattiello and Ruggiero immediately after this and see if someone will come on and just sit here and give us an explanation on a practical level. I can't see one, that would be acceptable at this point. It's just the nature of Rhode Island politics, the structure of power here, the systems that are built. The Speaker of the House is the most powerful, most influential figure in Rhode Island politics, an agenda setter. The Senate president, far less so, but still a mighty figure. So to not be front and center here, or not even front and center, behind the scenes getting things done, it just seems out of sync with the system that's been built anyway. This is the opportunity to step up. You want that role. It's been designed. It's been protected by elements, whether you're talking about line item veto or whether you're talking about just the nature of inside politics in Rhode Island. This is the moment to step up and utilize that position more so than anything in my lifetime that I can think of.
Bill, can I ask you a question? Because I'm sorry, I've been so busy at work that the dates are all running together. When did the governor actually announce about the starting to shut down the state? How long ago was that?
Jeez, I don't know. I mean, it seems like it's been a couple of weeks now.
All right. So let's just for figurative, let's just say 3 weeks that we realized before this. So you're telling me a week before that, she did talk to Mattiello and Ruggiero about this. And you're telling me that they don't have staff that could help start setting up internet programs where they can get together. Like, they don't have staff to do this. So that way the General Assembly could keep meeting. And they've given every excuse why they can't do it. And now we're in the middle of a crisis and they're still not doing anything. I'm appalled. I'm totally appalled.
Yeah.
I'm just feeling for what people are going to feel after this.
It's shocking. I just got to leave it there because there's no other way to put it. They got to get in there and make it happen.
Bill, people's lives are at risk right now. Their health care alone. How many people in our state don't have health care?
Right.
They could be up there expanding Medicare to cover these people. They could be raising the reimbursements in Medicaid to help financially the hospitals out financially. Those two things alone would make a huge difference. Those two alone would make a huge difference. We have a housing problem right now. People are on unemployment. I know they've raised the amount of money, but they still have to pay for food. They still have to pay for housing. Homeowners, same thing. They have to pay their mortgage. They have to pay their gas, electric. There is so much to be done, and you're out on your Harley and you're at home dog sitting. I'm sorry if I keep coming back to that, but I can't fathom that you have such a clear head about what's going on that you can relax and do that.
Yeah, it's the optics, and it's also the what's happening in practice here as we move further along in this. And again, it's about the purse strings. It's about utilizing the systems that have been built. The structure of Rhode Island politics is such that you have control of the purse strings more than anyone else. So now we need you to step up. And again, the governor, I know she said yesterday that there's no need for the General Assembly to meet. I got to look more and more into this. What are the specific reasons why, they're saying we should not meet? That's I have absolutely no idea what that could possibly be.
I out of all I generally agree with Gina Raimondo as far as this crisis goes. Yep. But that statement, I was taken back by, because they need to be there. They need to be there, and they need to be able to connect and be fluid, because this pandemic and what it's going to cause is going to shift radically. You don't know what's coming at us. I mean, they predicted only a certain amount of cases, but you don't know that.
Right.
And they need to be there, and they all need to be on board on what they're going to do. This is a time for us to all work together. This is a time for us. And the rebuilding of Rhode Island actually starts now, not after. But what you do now by building up a Medicaid, by expanding Medicare, by making sure people have health care, by making sure people have housing now, right now, will help after the crisis and help this state come through it better.
Exactly.
And you need a General Assembly to be together and work together, not be absent.
It's about stepping in now as well, because there's just so much confusion. I've been on some threads on Facebook and things like that, and I got one guy right here who wrote, well, if people try pulling the rent suspension as a means to not pay April 1st rent, I have no problem kicking all of my tenants out immediately. Another person says, bunch of lunatics, everybody wants something for free, et cetera, et cetera. So in other words, there's no policy. You've got the opportunity for people to, and I know that there is policy. No one can be evicted. That doesn't take away the anxiety. That doesn't take away the reality of today's April 1st. Okay. And there's plenty of people right now who have absolutely zero access to TDI, unemployment, or anything like that are expected to pay rents, mortgages, whatever it may be. So you would just think that this would be an opportunity for just straight up leadership. Step in, create a policy, figure it out. The economy's on pause. We're shutting it down at so many levels anyway. Let's move to a space where we're looking already into the rebuild, which would include not burying, 20% of the state right now.
How much you want to bet it's going to be almost 50% by the time this is done?
It's going to spiral. Yep. It's wacky.
I'm just amazed. I'm sorry if I'm getting a little too passionate.
There is no such thing. I mean, this is actually what you exemplify what I would want to see out of leadership: passion, action, game plans, understanding of the facts. Passivity is something that is part of the, what reeks in Rhode Island politics. The dismissiveness is what drives people away. It reduces engagement. It gives off the assumption, or it creates the assumption that it's an insider situation. And the less passion that we have from our leaders, the less soulfulness we experience as a whole. And I just think it's pathetic that all the things you're saying right now and the way it's manifesting, I just can't understand how someone could not feel compelled to do everything in their power to step up and chip away at these problems that may not even be in the public's purview. Funding of Medicaid, or Medicare rather, how that would be a major factor in the stability of hospitals right now. People probably don't even realize that, but it's because the assembly's not in session doing that people are also not aware of it, because the conversation is basically just on the outskirts of the news at this point.
Yep. And all right. The hospitals make their money from elective surgeries. Yeah. They make their monies from doctor's appointments. There's a lot of ways that the hospitals make their monies that they need to keep the operation going.
Yep.
Those are suspended. So now their flow of money is dwindling. So you help them by increasing Medicaid, the reimbursements, and covering people with Medicare, covering them. Now you're creating at least a stream of money that can go to them.
Yeah.
Okay. As far as mortgage payments and rent payments, you need a law to do that. You need a law to make that happen. How can you create a law when you're not even in session? Okay, how can you create a law to help people? Give them housing assistance, give them rent assistance, open the program up so that way people can get it and help them through the next 2 months.
Right.
Again, the rebuilding starts now. What you do right now is going to affect us long in the future.
100% agree. All right. One area that you had brought up when you were on the podcast I guess it was actually a couple of months ago at this point now, talking about minimum wage or at least just fair compensation. We're seeing, and I remember you made a very specific example of you have people you work with in the operating room who are critical members of your team that are paid in such a manner and such a form of compensation that they are required to have a second job, whether it's driving an Uber or just working unbelievable amounts of overtime in their existing capacity, and still live in poverty. Yet these are people who are critical to the operation of the healthcare system. So when people are screaming now about, oh, well, minimum wage or fair compensation, I had Mike Stenhouse and their Rhode Island Center for Freedom and Prosperity put out a position paper last week that said Rhode Island should temporarily suspend the minimum wage to get more people back to work. Actually, the opposite is people should be compensated in a manner that they can focus on the task at hand and live. Can you riff on that from your perspective inside the hospital?
Okay. Here's what should happen. If they were actually in session, bring the minimum wage up to $15. Bring it up. Okay? And set up a system for small businesses that when they raise the minimum wage, that they get a tax deduction. I know that's in the federal package, but do it in a state level right now and help them. So that way they'll get a tax cut for raising the minimum wage. And start the engine now. Get the policies in place right now to help Rhode Islanders out of this. Because every day that goes by that they don't meet, we sink deeper and deeper into a hole. And the deeper the hole goes, the longer it's going to take us to climb out.
That's the big fear now is obviously that's actually not true. The big fear is a medical scientific challenge that we are faced with. The secondary fear is, and it's a serious one, is how do we look as a state, I guess as a human race after all this? I think people are going to be fundamentally different in terms of how they behave. Interactions are going to change. How is it going to impact the restaurant, the music industries that are a big portion of Rhode Island? But on the ground, if we just think about it's July 7th, whatever situation is going on, how is the average Rhode Islander feeling? Are they feeling like we've got this? Are we on board? Is this like the space race? Is this like the original project, the revolution in the 1700s? I mean, is this like the communication between different tribes that sat here on this same land and for thousands of years? You know what I mean? Does it come from that same sort of collaboration? Or is this about the emergence of a truly an age of selfishness. We can kind of come out of this in one of two ways, either together or separately. And we have to make that decision right now. Otherwise, there is going to be no turning back, because we are going to go deeper and deeper into this sinkhole.
I'm gonna be perfectly honest with you.
Mm-hmm.
If Mattiello and Ruggiero are doing what they do, we're going to end up separated and fighting each other. I truly believe that the people of Rhode Island are better than what their two leaders are doing. There's a group of people that call Mask Makers Rhode Island. They're already starting to make masks for nurses, for healthcare workers, for frontline people. My neighbors, we all are checking on one another from each other's driveway. Where we have a neighborhood website that we're checking on each other, make sure people have what they have. I check on the two women across the street who are elderly. I walk around, I check on people. I think that's the true spirit of Rhode Island, and I think that's going to come through. And it's going to shame these two leaders that haven't done anything.
Yeah,
I think Rhode Island will always help one another. Our state may be separated by what their political beliefs are, or what they believe, their rights are. But when you come down to it, the people of Rhode Island will stick together and help each other out and rise up from this and walk past the two leaders that are doing nothing right now. And I truly believe that.
Mm-hmm. I do too. I think we have a unique situation here where there's an amazing, there's something that binds us together in Rhode Island. We're basically a county. We are a city state. And Dante Bellini Jr., my partner on the Fill-In Guys, another a good friend and someone who also hosts at WPRO as a fill-in, put out a tremendous video earlier this week that was, I guess, every walk of life in Rhode Island holding a sign, whether it was flatten the curve or something to that effect. And you saw healthcare workers, you saw Olympic athletes, you saw news reporters, musicians, artists, support staff in hospitals. You saw teachers. You saw everybody on board and depicted in this really beautiful video. And the essence of that was, to me, hey, whether you're a police officer, whether you, and you have a certain set of positions on, if you're someone who has a 2A position that differs from someone else, or whatever it is, all that is so far secondary to the project itself, which is to create a world where we all are able to live in peace. And that's not the generic, everybody, fist bumping and everybody's, it's not, and we're not talking about broad equality in 2 months either. We're just talking about a point where people aren't literally having panic attacks because they don't know how they're going to pay their rent, and people aren't stepping up in leadership roles to do things we're seeing in other municipalities like Austin. It's shocking. It's utterly shocking to me that people in leadership aren't stepping up the way that we're seeing police, firefighters, EMTs, doctors, nurses, other critical infrastructure participants step up.
Look what the nurses are doing, stepping out of their comfort zones and stepping up to help with what we're facing, getting retrained, working together, helping each other out. We work as a team anyway. All first responders, all frontline people always have to work as a team. But now they're going above and beyond what they need to do. I think all people in Rhode Island are really going above and beyond what they need to do. Without the proper mechanics to follow with that, we only can go so far. If without the leadership that we need to rebuild, we aren't going to go so far. And again, like I keep repeating, you're out on your Holly, you're at home dog sitting. How are you rebuilding this state? How are you starting to rebuild this state? And the Rhode Island Political Cooperative came up with a plan. And at least at the very least, they came up with a vision for us to move forward. if you have enough time to ride your Harley, then you have enough time to get to the assembly and get it together.
Totally agree. Last area, I guess, just you personally, how you doing? How you holding up? I mean, I saw some photos of you in personal protective equipment. You're in there.
I
What is it
I
doing?
love my job.
Yeah.
I and I love the people I work with. I work with this woman, Barbara Brown, and I she always we have a great working relationship, and she always tells me, just be the best that you can be today. Don't think about yesterday, don't think about the future, just today. Think about the best we can be. And if you just give me a second, I got to turn my phone on. I'd like to read something to all the healthcare workers and everybody out there working. I shut my phone off because it just kept going off, and my mother's alone, so I like to just make sure she's all right. That's
Yeah,
all.
no, I go for it. No, yeah, I agree.
I can't tell you what this has brought out in a lot of healthcare workers. The burnout rate was at epidemic proportions before this started. I'm just worried about afterwards, and that's where I think the healthcare workers and all frontline responders are going to really need help after this is over. Just give me 1 second, Bill.
Yeah, please, absolutely. And while you're pulling that up, it's, as you mentioned there, just keeping in touch with people. The mental health game that we're all being thrown into can be alleviated at a lot of levels, whether it's a professional person you're speaking through telemedicine or just conversations with your friends. I had a great chat with some of my friends all around. One was in Puerto Rico, and where there's a total lockdown, and that is relieving as well, to share the experience and to share the anxiety, to share the situations where someone has been impacted by the disease, whether they've tested positive, whether they haven't tested at all and they're showing symptoms, or whether they're in severe trouble at this point. It's these are the moments where the pack mentality can save us quite a bit of problems in the future.
We're social creatures, and this is very difficult staying apart.
Yeah.
So I'm going to read this. If I get a little emotional, I'm sorry.
No, don't be sorry, because that's this is leadership right here, my friend. This is it, ladies and gentlemen.
To all the nurses, respiratory therapists, CNAs, as healthcare professionals, as we walk into our shifts to take report, give report, and leave our shifts, work at it, work on it, work through it. Work to it as long as it is worth it, but never walk away from it.
I'm right there with you.
I'm sorry. Everybody, please stay safe. And let's just all be there for each other. Thank you very much, Bill.
Lenny, thank you so much. Let's keep in touch as this moves along. Thank you for running a bold campaign here in Rhode Island, that focuses on, by the way, it was before this crisis broke out that I first saw you step up at the Rhode Island State House and introduce yourself to the state in announcing your campaign and mentioning a lot of these critical gaps in our system months and months ago. And if nothing else comes out of this experience, I hope that people are really willing and able to take a look at the problems that we face societally and stop boxing them into some kind of category of, far outskirts of the political process, some kind of radical ideas. There's nothing radical about paying people a living wage, offering them the protections that they need, and participating in something that can actually help move the needle, whether it's social distancing or just providing morale support, morale boost, moral support, whatever it is, just supporting the leaders that we have. And I mean those leaders who are the people that are stepping up right now, and everybody knows who they are, just by following this every single day. And by the way, you're one of them. I appreciate it.
Thank you. Remember, this is our home, and we need to take care of our house, and we need to take care of one another. So thank you very much.
Thanks, Lenny.
This is the Bartholomew Town Podcast.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.